September is Chronic Pain Awareness Month. It's estimated that over 100 million people in the U.S. have chronic pain, costing an estimated $635 billion annually.
Well, these numbers are rising with baby boomers aging. Chronic pain has become more widespread, and cancer, diabetes, and heart disease combined.
UW psychologist Dr. Shilagh Mirgain joins us now to help us cope with chronic pain. Shilagh, good to see you again.
Thanks for having me.
So this is not something you necessarily have to live with.
No, as pain is persisting for people past that 3-month mark, it's considered chronic pain. And I really want to encourage people to seek out a medical evaluation as early as possible. You want to rule out, do I need surgery? Is there some systemic disease that's causing my pain, like cancer or inflammatory arthritis? Or are there just some complicating social or psychological factors that are amplifying or prolonging my pain? And then really seeking psychosocial treatment for your pain.
Yeah, it's interesting as we talk about the baby boomer generation getting older. So that's what's really showing this increase in chronic pain then.
I think it's definitely one of the factors. I also think lifestyle and just the stress we're under, specifically during the pandemic, that we're seeing a rise in pain. And, pain medication can be a really good option for treatment. However, there's some limitations. On average, pain medication only takes away between 30 to 60% of pain. That pain medication doesn't change underlying pain processes. And we know that sometimes people can get into a pattern where they're taking more and more medication and developing a tolerance, so it's less effective and there are unwanted side effects. So medication may be an option for you, but equally, if not more important, is to develop and learn skills.
You talk about developing a toolbox of coping strategies. What's that?
Yeah, we want a toolbox. Number one, keep moving. Motion is lotion. If you don't use it, you lose it. Pain inadvertently can cause people to become afraid of movement for fear of pain. They become overly sedentary, which over time really can cause more pain. And what's good for the heart, the cardiovascular system, is good for the body. So think about following those recommendations from the American College of Sports Medicine of doing 20 to 30 minutes, 4 to 5 times a week. In addition, work on those cognitive and behavioral skills. We're actually starting some new pain groups next week at UW Health, where we're working on that toolbox, things like developing thinking strategies, coping self-statements, so you're not getting into catastrophizing or negative thinking, working on pacing your level activity so you're not overdoing or underdoing, working on sleep hygiene, relaxation practices, really also working on increasing pleasure and enjoyable activities. And lastly, really improving your social support, because pain can be really isolating if we let it.
Yeah, there's a phrase, make meaning out of pain. Is that all part of it?
Oh, thank you for mentioning that. Absolutely, because as pain persists, many people can start to become overwhelmed by the losses and also the level of distress that it can cause if we don't manage it. Instead, really remembering that you're much more than this pain condition. Pain and suffering are a universal aspect of a human life, and those people who really create meaning really become the hero or heroine of their own story, really commit to values, how they want to live, what they want to be remembered for on their 90th birthday. Really minding their mind about their pain condition can really help them cope and really move forward, even if there's some pain still in the body.
Great advice as usual, Shilagh. Thanks for being with us today.
Thanks for having me.